Good morning. This is Robert Waters, MD, and this morning I'd like to talk about laboratory tests. You know, when we go to the doctor, we're often given some tests, and usually it's some simple things like a blood count chemistry and a lipid panel. And frankly, usually they're done to rule out certain obvious diseases like anemia or thyroid trouble, or to give an excuse to prescribe medications like for cholesterol and whatnot. Now, I would like to preface this discussion with the meaning of the reference range. That is the distribution that one sees for the laboratory numbers. For example, a liver enzyme might say 10 to 50 is the reference range. Note that it does not say normal range. And there's a good reason for that, because reference range merely means that 95 out of 100 people fall in the distribution of this curve. That the ones outside that distribution are the 2.5% of the people on the bottom of the range and 2.5% on the top of the range. So there's no claim made by laboratory scientists of what is, quote, normal. Now, that being said, we look at the laboratory data with that in mind. And when someone is near one end of a distribution, it may have meaning, especially in conjunction with their complaints. And for an example, the TSH level. There are many scientists now saying that the TSH level may not tell us the function of your thyroid gland. And in fact, the range of 0.4 to 4.5, a 10-fold difference from top to bottom, is totally inappropriate. And sometimes a person can even have a fairly normal thyroid test, TSH test, and they still respond to thyroid. Now, there are many other hormones that we measure in this laboratory. Hydrocortisone, DHEA, which is an androgen that's equally abundant in men and women. For women, we often measure estrogens and progesterone, especially in perimenopausal women, women with estrogen dominance that have various syndromes like blood sugar problems and ovarian cysts, and also for women in menopause, as well as for men in andropause. This country still hasn't embraced the idea that men go through hormone failure too. And so we look at testosterone levels in men and in women, because women make a lot of testosterone and need testosterone, but at a much lower level. So in this office, we do look at hormones. We look sometimes at other hormones as well, like pregnenolone and melatonin, although we often just prescribe these empirically, because in some cases they really add to the well-being of the patient. Now, these hormones, what do they do? People get worried about steroids because they're used to hearing horror stories where doctors use large doses of synthetic steroids like prednisone to dampen inflammation in the body or to regulate autoimmune diseases. And we're not talking about those kind of hormones. We're talking about bioidentical hormones, ones that are made in the human body under normal circumstances. And what do these hormones do? Steroid hormones enter the cell, travel through the cytoplasm, enter the nucleus, and bind to the very DNA, to response elements. So they trigger the production of genetic material that then is translated into proteins. In other words, you rebuild your body via steroid hormones. Thyroid is a different type of hormone. It's an amino acid derivative from tyrosine, and it binds cell membrane receptors and enters the mitochondrion and triggers energy transformation, the production of ATP energy. So this whole array of steroid and non-steroidal hormones are absolutely necessary for health. And one of the theories of aging is actually that we all experience gradual hormone failure. So our office is very interested in finding out about one's hormone status and in correcting it in conjunction with our other paradigm of meals, mitochondria, and microbiome.